that you have available on the Senior Marketing Specialist quoting tool. So we have expanded into a lot of different quoting features for you to really help you do more business electronically and to give you some more accurate quoting information, especially on the Medicare Advantage and prescription drugs. So we're going to go over several of the features for you. Hopefully you have been in the tool recently and have been playing around with it a little bit. I always encourage to get familiar with all of these tools. So if you go in and you practice your e-apps, you practice your electronic scopes, just so you feel comfortable when you are face-to-face with a client as well. So today we're going to go over the new Medicare Advantage and prescription drug quoting, which allows you to enter in your client's prescription drugs and preferred pharmacies and save them into the quoting tool. We're also going to go over the Client Manager bulk quote option. This allows you to do multiple Medsup quotes at one time. We'll review the electronic scope of appointment and document locker. I'll also show you how to do an e-application within this quoting tool. So you do have the option to do electronic apps for Medicare Supplement and also dental right now. We will be expanding that. And then last but not least, we'll get into the Market Pulse, which is a carrier document library. So let's go ahead. Let's dive right in. I'm just going to mention here quickly your client manager. You're going to see this option here. Your client manager allows you to import your clients into the quoting tool itself. So when you do run a quote for an individual, you can either run a quote from the client profile, or when you are running a Medsup quote or a Medicare Advantage quote, for example, you will have your client applicant drop-down menu, and that's all coming from your clients that you put into Client Manager. So although we're not going to spend too much time within Client Manager, I just wanted you to be aware this is where you can import your clients. You will need to make sure that your clients are imported to be able to save all of the prescription drug and preferred pharmacy information that I'm diving into here. So we do have some great training guides in the upper right-hand corner on how you can make sure all your clients are properly imported into here. So we'll get to Client Manager a little bit further here later in today's presentation. But I'm going to start off by going over the Medicare Advantage and prescription drug quoting here. So we have this new version. So this is a V2 beta. So we do still have the older version still available up here, but I'm going to demo the newer version. And again, this allows you to enter in your client's prescription drugs and preferred pharmacies. So as I mentioned, you have your client applicant drop-down menu here. So this is where you can select a client. Now, the first time that you run a quote for somebody, you will have to enter in their prescription drugs and their preferred pharmacies, as you can see down below. Once you've done that the first time, then the next time you go and run a quote for somebody, it would automatically populate those prescription drugs and preferred pharmacies. That way you don't have to enter them in every single time, or if you need to make an adjustment to one of the prescription drugs, it's really easy to go in and do that. So with this new Medicare Advantage and Part D quoting, once you have selected a client, their zip code, their plan type, so whether you want to look at a traditional Medicare Advantage plan or if you were just looking at a Medicare Part D plan, you can select those options there. You can sort by a few new options here, so annual drug and premium costs or annual drug deductible. If they do qualify for a low-income subsidy, you can select that over here as well. So we are going to show drug cost. You can select the fill method, whether that's retail, mail order, or both. And then all you would have to do is start by entering in these prescription drugs. So you would just hit add prescription drug. It's really great because you can just start by typing in a drug and it will populate those different options here for you. You would select that drug. If your toggle is on, this is going to allow generic drugs. So when you're looking at your dosage amount, these are all generic here. If this toggle is off, the dosage amount is going to show you the brand name in parentheses here. So in this example that I'm doing for you, I have a generic and I have a brand name. So there are tons of plans that may not accept the brand name, or your client is going to give you the brand name because they just don't know the generic version that maybe they really are taking. So just be careful on some of those plans may or may not be covering those prescription drugs. So you would select your dosage amount, your packaging, your quantity, and your frequency. And then you can keep it open to add multiple drugs here. So once you get all of your clients' prescription drugs entered, you can then add in their pharmacies. Now the pharmacies are going to pinpoint based upon the zip code here that you entered for the quote. So you can select multiple pharmacies in here in order to compare them. So I have those entered here, and then we'll just hit Get Quote. If you need to make any adjustments to the quote information, all you would have to do is click on any of the underlying items to make any quick adjustments. So if you did notice you had the wrong dosage amount, you can just click on any of these to make those quick adjustments. So over here, you're going to see what type of plan it is, whether that's health and drug coverage, how many of the drugs that I entered are covered, also how many of the pharmacies that I selected are covered as well in this example. So let's go ahead, let's dive into here. We will show you that max out of pocket over here on the right hand side, the drug and the premium cost as well. We have a couple of different ways in which you can view some of the plan details. So if I click on Show Details here, you have those options. The Show Details is just going to give you a brief overview of that particular plan, but it's also going to break out the county enrollment and the company enrollment numbers. So this is just telling you, out of everybody who is eligible for a Medicare Advantage plan in this county, how many people are actually enrolled. And then it's going to break down for this particular United Healthcare, how many individuals are enrolled with them, and then for this particular plan, how many are enrolled. So you can really view how much of the market share each company has within this particular county overall, and then for the plan type. Now, to get into the plan details, all you would have to do is click on that plan name. So once I have clicked on that, it is going to give me all of the information that I need for this particular plan here once it loads. So it will break down just the overview of the particular plan, all of the drug costs. So I have my overview section. Again, this was kind of similar to what we had initially here. So the co-pays, benefits, and the cost. So this is going to give you a full breakdown of all of the benefits and the co-pays for this particular plan. And then the R extra coverage and cost. So this is where you're going to start comparing the drug costs that you've entered. So you can see based upon the tier what the initial coverage, the gap, and catastrophic coverage looks like. Based upon the drugs that I entered, are they generic or are they a brand name? So you can see in this example, my generic is covered, my brand name is not covered. So that is a good example on making sure that when you are entering those prescription drugs, you're paying close attention to whether it's a brand or a generic version. And then from here, it's going to break down the cost for the cost for retail, before deductible, after in-gap, and after-gap costs. So we'll break it down based upon the pharmacies that you selected. Now, in this quote, I did notice that neither of the pharmacies that I selected are covered, so I would have to probably go back and revisit some of those pharmacies that I selected, because it does not look like they're covered for this plan. So that's why you're seeing how the pricing is structured here. And then it's going to break down whether they do that mail order as well, so the price difference there. And then as I continue scrolling, it's going to break down the estimated drug cost per month. So for each month, and then for each location of the pharmacies, and then the mail order. So what that's going to look like for them, and then what coverage phase that they would be in over on the right-hand side. So this can all be saved. So if you wanted to print this off and save this, you can do that as well. On this new Medicare Advantage and Part D quoting, we also have a comparison feature similar to the other products that we offer. So all you would have to do is click on this little check mark here, and this would allow you to compare different plans. That's notifying me that this is only the health coverage plan. So I can click on those, and then I can see the plan side by side if I wanted to do a quick overview of the benefits or the costs if I would go with these different plan options. So that is a new Medicare Advantage and prescription drug quoting. Again, the best part about this is it saves all of your clients' information. So after you enter in your client's information the first time, the next time you select them from your drop-down menu, it is going to continue saving that and just pre-populate that for you. So staying on the Medicare Advantage and Part D kind of space here, I'm going to quickly show you your new way to do your electronic scopes on here. So when you are doing AEP, being able to capture that scope electronically. So you have your document locker, and then you have your ESOA document signing. Your document locker is where all of your completed scopes will end up saving. So we'll get to that one here in a second. But in order to start an electronic scope, you'll just go ahead and click on View List here. All of your incomplete scopes will also save in your ESOA document signing. So if you're waiting for a signature or you're just waiting to finish completing that scope for after the appointment, all of those will save into your incomplete. So you do see I have quite a few incompletes here. They're just waiting for my producer data, or they're awaiting the electronic signature from the client. So all of your incompletes do save until after you get in there with your appointment. But in order to start a new one, you'll just click on Start Document here. You can download it or you can preview it. So this is a generic scope that we're going through and completing. And a lot of questions I get from agents on, why should I do a generic? Can't I just use the carrier scope? And I say, absolutely, you can use a carrier, but what happens if you put it on an Aetna paper and after your meeting with them, they don't go with Aetna? So just having a generic scope is just nice. That way it's not branded with any of the carrier's names, and you're still staying compliant during your appointment. So I'm going to go ahead here and start by giving my document a title, and then save and continue. So you can title that however you would like to, first name, last name, if you wanted to include SOA in there. This is just agreeing to the terms and the conditions of that electronic signature. So just scroll to the bottom and select I agree there. And then you have two options for your signature here. So you can do the applicant is in the same physical location. You have them providing identification information, which would be their mother's maiden name and the last 4 digits of their social security number. You also have an option to do an email signature link where it sends the applicant an email with a link and a verification code, and they can complete it that way. Now, since you are doing scopes electronically, it's my guess that a lot of you will be using this email signature link. So I am going to demo that one for you here today. I'm going to go ahead and type in my email address here. And again, you can practice these scopes too. So if you want to go through and practice what the applicant providing identification information, what those screens look like, or what the email one looks like, feel free to test them out. You can do multiple. I have so many test cases on my own account just so I can get familiar with them too. So it's just going to say waiting the applicant's email signature. So if I go back to my documents here, it would then show me here for David Smith, it's awaiting his email signature. So you would just let your applicant know to go ahead, open up your email, and then that gets sent over. So I'm going to go and pull up my email here so I can show you here what those look like. What's great about this is we haven't had any issues with items getting sent over to anybody's spam or anything like that. So, but if for some reason they have different spam features, if they don't receive it right away, always have them check their junk or their spam folder, but they shouldn't have any issues with it. So this is the email that they're going to receive. It's going to say an insurance agent. It will have your name on there, is requesting your your e-signature for the scope of appointment. So they'll just click on this link here. They'll type in their verification code and they'll hit verify and continue. You are also going to receive an email as well, just kind of a blind CC, just so you know that email has been deployed as well, as in case you get any questions on it. So they'll just go ahead, they'll check mark which products they want to discuss with you. Then they would type in their name. I think I used David Smith. Then they'll just acknowledge the city and the state that they're signing in. So really simple, easy for them to go through, select, apply e-signature, and then sign and complete. So now it says your email signature has been received. So you, the agent, is going to also receive an email letting you know that that scope has been completed. So I'm going to show you that. I just got that into my inbox here. So this is what I have here. It says scope of appointment. Your client has signed their document. So once you receive this email, you're receiving that in real time. You can go back in to your documents here, and if I refresh my browser, it will then say signed, waiting producer data. So I'll just go ahead and I'll click on that. So after my appointment with him, I can go through and complete this. So I'll just hit continue here. And then most of you will want to know what they agree to speak to you about. So if you click down here at the bottom, it says preview. This will then initial, here you can see his initials to see what he agreed to discuss with you, and then that signature. So then after your appointment, you can just go through here and you can fill all of this out. So first name, phone number, address. They're all pretty standard fields here, so you should be used to those. Plans discussed, you can type those in. Date of completed, you can hit continue. And then you just check mark apply e-signature and then sign. So really quick and easy to go over this electronic signature. You then have the option to save it to your library. So I can preview this here. I can save it to my library, and then once it's in my library, I can go ahead and download it if I do need to upload it to an application or anything like that. So this is your document locker. Within your document locker, you can have folders for all of your clients. You can have you can have subfolders as well as just parent folders. So that's just adding a new folder here. You can also upload any other supporting document. So if you did want to upload a quote or an e-app or in any other type of document, you can do that as well. And then you can search for a document. So after you have completed it, if you did need to quickly search it, if you can't find it within all of your folders or anything like that, we have this search feature. So then you can always download it or preview it here. So here's my David Smith. I can preview it, and then I have that option to download. Now, maybe you're kind of concerned on, well, I have all of these different scopes completed in here, then what happens if I am no longer doing business and I want to save these in order to stay compliant? We do allow you to export your document locker as well. So you do have that option to export everything that you have imported in there. So that is electronic scope and document locker. Hopefully you guys have found that as simple and easy there to use. The next I'm going to kind of switch gears here and go into our Medicare Supplement e-application. So with the ability to quote, you also can submit an application within the quoting tool. So we have a handful of different carriers on our e-application platform. What is great about the e-app is no matter if you're doing an application for Aetna or for mutual Mutual of Omaha or United Healthcare, the application process is going to be the exact same. So we know it can be difficult having to learn every single carrier's platform. So we have created what we call a universal e-app that allows you to submit applications. So it's kind of one process for you to go ahead and be able to learn here. So any carriers that we have on the e-application platform, you'll see an apply now and an add to cart. So what the add to cart essentially allows you to do is create a client shopping cart for an individual. That way you can do a Medsup and also a dental at the exact same time, which is going to save you a lot of time there. So you can pick your products here. So I'm just going to show you how to create a client shopping cart. So if I click add to cart, it is going to want me to select a client, or I can create a new client here if they have not been added into my system. Can create that. Now it puts my plan into my little shopping cart icon in the upper right hand corner. So I have my Medsup with UHC. And then let's say I also wanted to do a dental. So this is allowing you to cross-sell more efficiently because you can submit multiple e-apps across carrier lines too. So you can see it automatically carried over David's zip code for me, so I don't have to re-enter that in. But once I have my list of dental carriers on here, I can select any of the dental carriers that we have on the e-application platform as well. This is just taking a second here to load. So let's go through and find Manhattan Life, for example. They are on our e-application platform. So if I click on add to cart here, I now have in my client shopping cart my Medsup with UHC. I have my dental with Manhattan. This little air icon right here, this just means I need to go ahead and validate my agent appointment with Manhattan Life in order to check out and actually do that e-app. So you can see here it adds my gross premium amount here, and then I can just check out. So when you do check out for a shopping cart, you will go through, you will complete the Medsup e-app, and then after that has been submitted, it will take you right into the dental application. And what's great is it will take all of that client's information on the Medsup application, so their mailing address, their phone number, their email, social security number, and it will automatically populate it into the dental app. So it's going to streamline that process for you and make it really simple and easy to do multiple applications at one time. So that's how that client shopping cart works. Again, you do need to make sure that you validate your appointment there. I'm going to just show you here the other option if you did not want to create a client shopping cart. You just wanted to go in and apply now. So I'm going to go back to my Medicare supplements here. Now, the first time that you try to submit an application for an individual, it is going to ask you, or for a particular company, I should say, it's going to ask you to validate your appointment. So you do have to be appointed with a particular carrier in order to get into that e-app here. So let's look at United Healthcare here. So I'm just going to hit apply now. Now I have submitted applications for United Healthcare already in the system. So it has already remembered my producer number with them. So it automatically took me right into the application. So, but the first time that you try to get into the application, it is going to ask you to validate your appointment. So you do have to be contracted with them. The first time you get in here too, this is going to look the exact same. So even though in this I'm doing a AARP, UHC application, if I was doing Mutual of Omaha or Aetna or any of the other carriers that we have on the platform, this process, this same look and feel is going to be the same. So it automatically carries over all of your quote information over here on the right-hand side. You have your notifications tab up here. So if you are doing a fully underwritten application and you answer yes to a decline health condition or you enter in a decline prescription drug, it will notify you of that individual may not be issued coverage. Or if for your underwriting type, if you select the wrong underwriting type and then based upon your Medicare Part A and Part B effective dates, it doesn't match that underwriting type, the system will notify you of that as well. So it is going to make sure that all your applications are submitted in good working order. So after you enter in the underwriting type here, all you'll have to do is go through and hit continue. Now for time purposes, I'm not going to go through and complete an entire application, but I have done several applications on here for an open enrollment, and I kid you not, it takes me 5 minutes to go through start to finish and complete an app. So it goes really quickly. It's very user friendly. I'm just going to talk through a couple of things here on the e-application. As you go through each of the sections, that it will populate here as soon as I get to the next section here. Once you have completed a section, it will have a green check mark. If there is a section that you have to go through and still complete, it will have this yellow air icon, just meaning that we're still needing some more information from you, or there's something that is incorrect there. Then once you have gone through the sections, the system automatically saves that section for you. So you won't see any save button anywhere on here. That's because it is saving for you as you go through and complete each of the sections here. Once you have green check marks on all of your sections, you can go ahead and sign the application. So depending on the carrier, we have different signature methods. Most of the carriers, we have that email signature link, which is similar to that ESOA one that I showed you. The other option is the applicant present, which they would provide their mother's maiden name and the last 4 digits of their social security number. So each carrier is a little bit different on how many signature options they allow, but you do have some different options there. Once your applications have been submitted, all of your applications will store in your e-applications panel. So any of your incomplete or even submitted ones will store here. So once it has been submitted, it would say submitted. Now, in order to check the status of the application, you will have to visit that carrier's website to check the status of whether or not it's been issued or not. So that's the e-application. I know I went through that pretty quickly and I didn't demo an entire e-app, but keep in mind you can get in here and you can practice. So get into the e-app, start an application, get your national producer number or your writing number validated in the system, and then just go through the different sections just so you can get familiar with what those screens look like, and then just don't go through the signature process. Just stop before you get there. All right, so the next option that I'm going to go through here on this training is within Client Manager. We have an option that allows you to run multiple Medsup quotes at one time. So this is going to save you a ton of time. If you have purchased a lead list or you have clients that are getting a rate increase and you want to run a bulk quote for all of those individuals at one time, your Client Manager allows you to do that. So within each client profile, you can include their current products that they're on. So if they're on a Medsup plan, you can type in the carrier, their current premium, and the plan type that they're on. So you can add in if they're on a Medsup or a Medicare Advantage, dental, hospital indemnity. You can add in any of the products that we support for quoting. So you can have their client profile. No data here. That just means we don't have a gender or a state for them. Now, with these that have no data, you will need to make sure that you do have the data in there. Otherwise, you wouldn't be able to run a bulk quote for those individuals. If you've uploaded clients into here and you need to delete them, just like I just did, you can do that as well. But within your Client Manager, you can add different filters for viewing your clients. So for an example, let's say Aetna came out with a rate increase and you want to reach out to all of your clients who are on an Aetna plan. I'm going to select my Medsup carrier, so I want to filter by Aetna. And these are my 3 clients I have currently on an Aetna plan. Or you can say, I want to find any of my clients that are in a certain state. Or maybe I want to find any of my clients that are currently still on a Plan F. You can do all of this different filtering here, and you can do multiple filters. So you can search by carrier and plan type and state. That way, if you do get a notice that a particular carrier is coming out with a rate increase, you can quickly reach out to those clients as well. So in order to do the bulk quote, you would just hit select. You'd go through and you would select the individuals that you want to run the bulk quote for. Again, we do have to make sure that we have all of their information in here, their zip code, their age, their gender, their tobacco status, and able to actually do the quote. So you would select those individuals and you would hit bulk quote. You would then choose the effective dates of the rates. You can say I want to run it for the current plan that they're on. So if they're currently on a G and you want to run it for a G, just say current plan, or you can say I want to run everybody for a plan G. You would then select the companies. So you would select all companies, or if you just wanted to run a quote for Aetna, Mutual, and Cigna, just select Aetna, Mutual, and Cigna. We will always return the 3 lowest premium options based upon the companies that you have entered in here. So I'm looking at everybody in the market, but again, if I just wanted to run a quote for everybody for one company, I would just select out that one company there. So you can see how quickly I was able to run a Medsup quote for all of these individuals at one time. So again, if you have a lead list and you have a lead list of 100 leads and you want to upload them into the system to run that bulk quote, this would be a great option for you. So I can compare if I have the current information that they're on into the system. I can see that information here. So I can see they're currently on a UHC plan for $100 a month. Here are some lower premium options for them. If I want to get in and view all results, I can just click on view all results, and this will take me to the full quote results page. All of this data in here can be exported as well. So if you wanted to export the results, you do have that option. It exports into an Excel file. All right, last but not least, we are going to go over our Market Pulse. Our Market Pulse is our carrier document library. So any carrier documents that we can publicly source, we'll put them into Market Pulse. So you can search by year. So I do recommend making sure that you do have your year selected if you're looking for a particular document type. So we allow you to look for agent guides, underwriting guides, mailers, advertising pieces, brochures, forms. So again, any documents that we can publicly source, we can't just go through an agent login and start pulling documents, but you can select your product type there. And then you can also do your state. So if you're looking for a state-specific form, you can search by state. We also allow you to search by company as well. So you can select the company, and then you can also look at your product type here. So whether you're looking for a life, a Medicare supplement, a Medicare Advantage, annuity, you can have these different product filters. We have a variety of different products in there. We also have the option for you just to type something into search in the document. So if I just wanted to type in Aetna, or I was trying to type something particular, you can do that and then just hit run search. And then it would bring up any documents that we have for what you have searched for. So I just did 2021 Aetna, so now it's going to bring me some different types of documents here. In order to view what products, you can click on this view to see what products are associated with them, what type of piece it is, whether it's an agent advertisement, a newsletter. If I wanted to preview this document, I can just click on preview, and I can see this document in here. And then I can always download it as well. So there's Aetna's product availability chart. I can preview that. Again, make sure you're looking at the date too. So make sure that you have the most up-to-date one. You have all of those. So this is great if you're just kind of interested to see what other companies are putting out there, or if you're having a hard time finding a particular document, or maybe you're thinking of getting contracted with a certain carrier and you just want to check out what's going on within that company. This is one option for you in Market Pulse to be able just to search for a variety of different document types across product lines and across carriers as well. All right, Sadie, that was a pretty quick and brief overview of some of these newer features. I do want to allow enough time for questions as well. So if there's any questions, I'm happy to start answering those.
Yes, you went through so much, and thank you so much for doing this. I learned a lot, and we have plenty of questions, really great questions. So thank you so much. Um, Now, we do have a few questions kind of asking about what's the difference between this and Medicare Center? Is this replacing Medicare Center? A few questions around Medicare Center, which totally makes sense. And so let's just kind of try to clarify this just a little bit. Short answer, no, this is not replacing Medicare Center. One really cool thing about this is you can actually use the CSG quote enroller. It is housed within Medicare Center. So you can use this within Medicare Center. Now, I won't get into too many details about Medicare Center because that's a separate webinar. And actually, we're having that Medicare Center walkthrough this Friday. So if you want to get registered for that, Olivia will be going through a deep dive of Medicare Center, all the different moving parts that are within it. So make sure to get registered for that webinar. You can find that on the events page, same way that you found this webinar. But no, you can kind of use them hand in hand. Now, today we went over specifically the Senior Marketing Specialist CSG quote engine. This is one that we've had for quite a long time. Many of you have probably been using it for a while, and it's housed on our website. But you can use the CSG tool through Medicare Center. So hopefully that kind of clarifies that a little bit. Like I said, if you want to learn more about that, you can join us on Friday. But we do have a few more questions. Okay, so kind of going back to the MAPDP portion, can you select mail order as the preferred pharmacy?
Yes, you can. So any of the on the Medicare Advantage, if you just want to look at the mail order, you would just select mail order, and then that wouldn't bring in any of the pharmacies. You wouldn't have to enter any pharmacies there.
Awesome. Let's see. Let me scroll through here and try to find it. Are you able to show the standalone PDP? So I think that's, yeah, same portion.
Yep, absolutely. So all you would have to do is click on Medicare Part D here, and then those are all of the standalone ones.
Awesome. Will other companies be added to the Medsup e-app? So do you have any other companies that might be able to be enrolled in?
Absolutely. So we are continuing to work through a handful of different companies. We have a handful of different companies on there today. I know a popular one that will be getting added here shortly is Cigna. So they are next up on the list to get implemented. But throughout the year, you'll see more and more companies added to that enrollment piece.
Awesome. That's exciting. We do have just a few more questions, so if you have any questions lingering, go ahead and put them in that Q&A box. Otherwise, we'll get these answered and then we will get you guys back to your day. But let's see. If I have a carrier that I am contracted with through another FMO, can I still submit the application and get credit for it? So that's a good question. Today, like I said, we were going over the Senior Marketing Specialist quote engine. So if you're using that, like if you go to our website and you click on quote engine and you're using this application that you see today, you will only get credit. You can only do it for the carriers that you have through us. Now, that might be a different story on Medicare Center, but like I said, that's a separate webinar. We'll talk about that later. I believe if your FMO is an integrity partner, then maybe so, but specifically for this quote engine, you will only be able to get credit for the carriers that you have through Senior Marketing Specialist. That was a good question. Do only the incomplete applications get removed after a certain period of time, or do all the applications get removed after that time period?
So with the e-apps, each carrier is a little bit different on how long they store the e-applications on this particular panel. So any incomplete will store for 90 days. Any submitted one, it does kind of vary based upon carrier. Some carriers allow 30, others allow 60 days. So we will show you that submitted status. So if you did want to download that PDF version and then maybe upload it into your document locker so it always saves there, you could do that option. Otherwise, it's automatically going to transfer over to the carrier's website and it will store on the carrier's website.
Awesome.
Mm-hmm.
Okay. Does the prescription part have a breakdown for stages?
Yes, as far as what coverage phase that they're in. I think
Yes,
that's
I
maybe
believe.
what they were referring to. Yeah. So let me show you that here. I just select that client, quickly showing through here. Now I did, let's see here, click on that particular plan. If you go into the RX and drug coverage and costs, those stages or their coverage phase, they would be listed over here, whether they're their initial coverage, gap. This says unavailable, and that's just because these pharmacies that were in this quote were not included as being covered. But this is where it would list out all of the coverage phase that they're in. Hopefully, that's what they meant by that.
Yes, I believe so, Jim.
Okay.
If correct us if we're wrong, but I think that's probably what he was asking for. Will you be able to, so he said good, yes, so that was right.
Okay. Perfect.
Will you be able to submit MAPD or PDP through here in the future?
Yes, it is coming up in the near future. We have filed all of our enrollment screens for that with CMS, so we are just waiting for their compliance approval. But that is on our roadmap is to include the Medicare Advantage and Part D enrollments on here as well.
Awesome, that's exciting. Is the processing time for an application the same as submitting directly to the carrier?
Yes, it is. So we submit to the carrier in real time, so it automatically goes right into their underwriting queue. The only one that's not submitted in real time is United Healthcare. United Healthcare is submitted in batches every 2 hours. So it's still being submitted within that same day. We just send all of those applications in batches. Just depending on where you're at in that 2 hour time window, it may be 10 minutes, it may be an hour and a half, but it will eventually get there within that 2 hour time window. And then what's also great about it is if any of these carriers are doing incentive programs for submitting e-apps, ours also count. So I know, and as a popular one, they kind of do some incentives on submitting apps electronically. So any of your electronic apps on our system count towards those incentive programs as well.
Awesome. Let's see. We have one more question here. So like we said, put those questions in. Otherwise, we'll get you guys out of here. Brad's asking, was there a security question feature for the signature option on the scope of appointment? Or does the scope of appointment still have to be sent electronically to them for a signature?
Great question. So on the electronic scope, if the applicant is present, you can do that all. You can do all of that. The signature would be their mother's maiden name and the last 4 digits of their social security number. So that's what that looks like. I think I can maybe get into an example on one of these here so I can show you what that in person looks like. And here it is. So if they are present with you, you can just have them select the plans, and then this is their signature if they were present. Mother's maiden name, the last 4 digits of their social security number, and then just acknowledging the city and the state that they're signing in.
Awesome. Will the e-apps allow us to do the health assessment and get paid for that?
Yes, so if a health assessment is needed, afterwards, United Healthcare would contact you directly to complete that health assessment.
Awesome. That's a great question. Okay, so if you have any last minute questions, go ahead and put them in here. Anna, thank you so much. This was really awesome. I've been working for senior marketing specialist for a couple of years, and one of my first jobs here actually was helping agents through this quote engine. And so it's been really cool to kind of see throughout the past couple of years all the new exciting features that have been added. And yeah, it's really exciting to see a lot of really cool features being added, and even a few more being added here in the future. So thank you so much for going through those today. We went over a whole lot of stuff today, guys. So remember that this was recorded. We'll put that in the follow-up email. Also, we will have the follow-up call. If you have some questions that come up afterwards, that call is a great time to ask those questions. If you have a few more questions about Medicare Center and how CSG works with Medicare Center, ask those there. And also remember to get registered for that webinar as well. But thank you so much for joining us every day, or today, I'm sorry. Anna, thank you so much for being here.
Yes, absolutely. Thank you for having me.
Absolutely. Thanks, guys. Have a good day.